Assalamu alaikum, yakan abdu wa yakan astain. Welcome to my channel Dr. Shami Says. So in today's video I'm gonna go through the quick recalls of surgery 8th February 2025 paper. So question number 1, a 50-year-old patient with a history of the liver and the biliary disease presents with the fatigue and the weakness. Laboratory test reveals the deficiency in the vitamin B12, which is the following vitamin is also known for the anti-aging properties and often use the conjunction of the B12 with the liver and the biliary diseases. That is vitamin E. The patient presents with the thrombocytopenia, prolonged APTT, which is the following coagulation factor is the most likely deficient. That is the factor number 10. The patient with the Christmas disease requires replacement of the deficient clotting factor, which is the appropriate treatment. That is FFPs, which gram-positive bacteria is known to cause a toxic shock syndrome, the production of superantigen superficially a cap protein, that is the step aureus. Question number 5, the patient presents the septic shock caused by the gram-positive bacterium that produces a capsule composed of the polysaccharide, which of the following bacteria is most likely responsible. There is a step pneumoniae. The patient with HIV AIDS presents with the chronic diarrhea, is the following organism is most likely responsible. There is the Cryptosporidium parvum. The patient presents the meningitis in the CSF analysis shows protein 2 glucose 50% of the serum glucose, lymphocyte 90%, total cells. Which type of the meningitis it is? That is the viral meningitis. The elderly pneumonia is most commonly caused by the step pneumonia. The patient presents with the purulent pneumonia characterized by the thick yellow greenish sputum. The organism would be the Staph aureus. Subacute infective endocarditis is caused by the step viridans. The patient presents the ability to abduct the little finger to the following nerve is most likely affected. There is ulnar nerve. The rotator cuff muscle is responsible for the initial abduction of the shoulder joint would be the supraspinatus. Damage to the posterior cervical region may result in the injury to the following nerves. The spina excessive of the patient presents the traumatic injury from the chin to the suprasternal notch. The following vertebra is most likely to be damaged. That is C5, C6. Damage to the talus bone is most likely to affect the following structures. That is the medial arch. The pregnant woman with the hypothyroidism requires treatment. The following medication is preferred in the first trimester. That is propylthiouracil. Following a cholecystectomy, surgical drain is typically placed in which of the following location? Right subhepatic space. Last sensation, the rostrum of the hand is associated with the damage of which of the following? Radiation of bacterialis fragilis is characterized by which of the following features produces a black pigment? Pancreatic cancer is most likely to invade the following major vessels. The portal vein. During a cholecystectomy, bleeding is most likely to occur from which of the following structure? There is a cystic artery, which is the following scenario is most likely to lead to the development of the DVT. There is a prolonged embolization. The carnitine plays a crucial role in the transport of fatty acids in the mitochondria for the beta oxidation. Maple syrup urine disease is characterized by the accumulation of the branch and keto acids. During cellular respiration, the complete breakdown of one glucose molecule, glycolysis, citric acid, oxidative phosphorylase yields 38 ATPs. Von Gecke disease is caused by the deficiency of which of the following glucose phosphatase? The following genetic disorder is associated with the autosomal recessive inheritance. It's a child polycystic kidney disease, which the following genetic disorder is associated with the autosomal dominant inheritance. Adult polycystic kidney disease, lactase dehydrogenase enzyme that catalyzes the conversion of pyruvate to lactate. What is the approximate volume of the extracellular fluid in the typical 70 kg adult male? That is a 14 liters. The coagulative necrosis typically seen which of the following conditions? Myocardial infarction. The fat necrosis typically seen which of the following conditions? Chronic pancreatitis. Vitamin D deficiency is commonly associated with the following conditions? Your chronic pancreatitis with the following condition is characterized by the spleen's role in the removing abnormal red blood cells. Hemolytic anemia, which is part of GIT, is the vitamin B12 primarily absorbed. The terminal limb to the following syndrome characterized by the confusion ataxia of thermoplastia caused by the deficiency of vitamin B12. That is the Wernicke-Korsakoff syndrome. The following lymph node group is primarily responsible for the draining the prostate gland. There is the internal iliac lymph nodes. The following lymph nodes group is primarily responsible for draining ovarian cancer. Para-aortic lymph nodes. The following lymph node group is located at the level of the first lumbar vertebra. There is the para-aortic lymph nodes. Ovarian cancer most commonly metastasizes which is the following lymph node groups? Para-aortic lymph nodes. The following is the common site for drainage of the ovaries. There is a para-aortic lymph node. The following lymph node receive the drainage from the anal region below the dentate line. There is the superficial inguinal lymph nodes, which is the following the characteristic feature of the proteoglycans. The negative charge of the following easy change is most commonly cetoxin toxicity. That is the scooped or the sagging ST segments. The following is characteristic feature of apoptosis. The DNA fragmentations. Following is the second most abundant constituent of the protoplasm proteins. What is the potential effect of the combining metformin with the chlorothiazide on the blood glucose level, that is the hypoglycemia. Falling antibodies most commonly associated with the pseudomonas colitis. Clindamycin, what is the primary action of the insulin on the glucose metabolism, that is the stimulate glycolysis. Which part of the adrenal gland secretes adrenaline? Adrenal medulla. Which of the following organisms is associated with the warm water and can cause the keratitis? Acanthamoeba. The following drug is the cytochrome P50 inducer, P450 inducer, but can also be inhibited by the drug, specifically inhibitors of the cytochrome P450, erythromycin, the cimetidine, carbamazepine. 70-year-old patient diagnosed with pancreatic cancer. The following aspects of counseling essential to address the avoiding creating problem with the principle of biomedical ethics. Truth telling both the prognosis and the end of life care. The patient presents the loss of accommodation. What is the ability to focus on the near object? Which of the following structure most likely involved? There is the renin-7. Which of the following drugs act by inhibiting the hydrogen potassium ATPase pumps in the gastric parietal cells? The omeprazole. Which the following enzyme is present in the snake venom, that is hyaluronidase. Patient presents with the compressive lesion on the CBD. Which of the following structure is most likely responsible for the compression? Answer is not given here. The patient presents with the perforated renal ulcer. During the surgery, the following artery is most likely to be damaged. There is the pancreatoduodenal artery. Gastroduodenal artery. The patient the antiphospholipid syndrome requires the anticoagulant to prevent the thrombosis. Which of the following medication is most commonly used? That is the warfarin. The patient presents the excessive thirst and the drinking behavior. Is the following hypothalamic nuclei is most likely responsible for regulating this behavior? There is a paraventricular nucleus. The supraoptic nucleus is then linked with the oxytocin. Next, 35-year-old patient present the chronic diarrhea, abdominal pain, weight loss, stool or cold blood test positive. The following is responsible for these symptoms: ulcerative colitis. The patient with the jaundice, anemia, laboratory test with elevated bilirubin and LDH. The following condition most likely responsible for these findings: hemolytic anemia. The patient with sickle cell disease, expensive vasoacute crisis, the sickening of the red blood cells. The following tissues are most commonly affected by this process: the bone marrow, capillaries, and spleen. Did the thyroid surgery with the following nerve is a risk of injury and can result in the focal paralysis. External angina. Patient present the fatigue, weight gain, the dry skin, laboratory test reveals TSH elevated 34 degrees. Falling disease, hypothyroidism. The patient present the bleeding gums, fatigue, and easy bruising. Laboratory tests are these. This is the bone marrow aspiration. We must go for the definite diagnosis. A 40-year-old present with early resection to the Crohn's disease. Following deficiencies in the patient likely to develop over the time: B12 deficiency. During the complete breakdown of one glucose molecule, the combination water homogeneity is produced in the cellular respiration, that is the 38. The patient with the blood type O negative receives blood from the donor with the blood type O positive. Which of the reaction is expected and which antibody is responsible? That is a hemolytic reaction, antibody IgG. Next, which of the following immunoglobulin is the primary antibody responsible for secondary immune response and provide long-term immunity? That is IgG. Patient present the severe abdominal pain, nausea, and vomiting, water test feels elevated mileage levels, elevated TLC quantity. The following diagnosis most likely the acute pancreatitis. Present with the severe eye pain, blurred vision, headache, intraocular pressure reveals right eye 30 and left eye 15. The following condition most likely causing the elevated eye pain in the right eye: acute angle closure glaucoma. 73. The 30-year-old woman with the symptoms of UTI, including dysuria, frequency, and urgency. Urine culture reveals the gram-negative or Escherichia species. The following organism most likely responsible for the patient's UTI: the Escherichia coli, most common. The bacteria isolated from a skin lesion is found to be gram-positive, catalase negative. Bacteria responsible would be Streptococcus pyogenes. The following nerve supplies the adductor magnus muscle, that is the obturator nerve. Patient suffers an injury to the extension of the leg. Which of the following nerve is likely to be damaged? There is a femoral nerve. The patient suffers an injury to the lower brachial plexus. Which of the following muscle is most likely to be paralyzed? Flexor carpi, realize flexor profundus. The left damage of the labia majora is the superficial lymph node. The carcinoma of the prostate is likely to spread by the lymphatics into the internal lymph nodes. The shoulder separation that involve the lateral end of the clavicle sliding on the superior spectrum of chromium is most likely result from the damage of the coracoid ligament. After injury nerve at the wrist, the thumb is likely irritating and adducted. The hand looks flattened and ape-like. The nerve that has been damaged would be the median nerve. Adductor longus muscles is innervated by the anterior vein of obturator nerve. If the foot is permanently dorsiflex and everted, which nerve might be injured? That is the tibial nerve. The anterior ethmoidal sinus drains into the middle meatus of the nose. The nasolacrimal drains into inferior meatus of the nose. Which of the following nerve might be injured when trying to When tying the inferior thyroid artery during operation on the thyroid gland that is region of patient admitted in the hospital with acute pericarditis because the movement of the heart was compromised by the excess of the blood in the pericardial cavity, and the cause of the infection was unknown. It was decided to perform a pericardiocensis. Specimen of blood was kept for the bacterial examination. Pericardiocensis is best performed by passing a needle through the subcostal angle. The patient brought to the emergency after arterial suspected cardiac injury. During the injury, the surgeon's hands feel a structure on the posterior surface of the heart. The following structure is most likely being felt. That is the coronary sinus sulcus. 25-year-old patient present the calcification in the iliac bone. The following condition most likely associated with the finding chondromas. Histopathological examination of the bone tumor reveals a mosaic pattern of growth. The following tumor is likely associated with this pattern. That is Ewing sarcoma. Occlusion canal or oriented perpendicular to the long axis of the bone. The patient presents with the intracranial hemorrhage. The midmeningeal artery is commonly involved in the hemorrhage in which of the following locations. The cerebellum. Intracranial hemorrhage due to the trauma is most likely associated with the damage in which of the following arteries. It is the middle meningeal artery. Patient presents the ureteric stone obstructing the flow of the urine, which is expected affecting the GFR. That is the decrease in the GFR. The patient experiences the decrease in the blood flow to the hemorrhage. What is the expected effect on the glomerular filtration rate? The decrease in the GFR. The decreased lymphatic flow is associated with the hemorrhage. The ulnar nerve and the flexor retinorum superficialis are related to the flexor retinaculum in the following way. Both pass superficial the flexor retinaculum. The ulnar nerve and the flexor retinorum superficialis. During a tracheostomy procedure, the surgeon must be careful to avoid injury to the anterior jugular vein. The most common location for the BPH would be the transitional zone of the prostate. The danazol is contraindicated in the postmenopausal breast cancer. The which of the following medication is contraindicated in the postmenopausal breast cancer is the danazol. 1 or 2 25-year-old patient is diagnosed with Hodgkin's lymphoma disease is found in involve the lymph nodes on both sides of the diaphragm, but there are no systemic symptoms. According to the Auber staging system, the classified as stage 3. Now injection the upper outer quadrant are given with the technique to avoid damage to the sciatic nerve. The following is contraindicated in the acute intermittent porphyria, that is the thiopental. With the following is recommended diagnostic approach for the asthma, that is spirometry plus bronchodilation. Barrett's esophagus is a pre-cancer condition that increases the risk of developing the adenocarcinoma. The characteristic histological feature of the Barrett's esophagus would be the simple columnar epithelium with the gallbladder cells. Condition is with the increased risk of the COPD and the liver disease, that is the alpha-1 inhibition. In the Karachi, the Pakistan, the most common type of cancer would be the oral cancer. Smoking is associated with the exposure to the polycyclic aromatic hydrocarbons. That's all from the today's recall. Thanks for watching my video. Do subscribe my channel. Until my next video, Allah Hafiz.